Hi everyone. It's March 23rd, Monday, new week. This morning we heard from the governor who revealed 7 new positive cases in South Dakota in the last day, 7 new test results. More in East River, but finally a case that has crossed the river in the Chamberlain area. So there's a lot of urgency around the message to practice social distancing and to take the recommendations of the CDC and the city and the state and health officials seriously. Okay, we are the morning after the first reading of an ordinance that would propose several closures of certain businesses around town for public health reasons. So today we're fielding hundreds of messages relative to that proposed city ordinance, and we'll continue to do so as long as they're coming in. There'll be another special city council meeting Friday at 6 o'clock p.m. to finalize that issue. So we're going to have a lot more evidence of what the current situation is by Friday. The Civic Center is now locked down. The ambulance services continue to transport patients with symptoms consistent with COVID-19. That doesn't mean they have it, but it doesn't mean they don't either. 5 such patients yesterday. Casino robberies continue to be a problem, and if the proposed business closure ordinance passes on Friday, the 27th, casinos will be closed. So the RCPD will be reevaluating the strategy and how to project if there's another likely target that may need additional security. The Parks and Recreation offices are now closed to the public, as are all the public works buildings around town. City Hall is closed today. We have a nice little setup down in the lobby where you can come into the lobby to pay a bill if you like. There's a drop box. You won't get a receipt as you normally would. We're still encouraging people to mail those or set up an online pay account for utilities. So we're also creating workarounds for licensing processes here that usually require a city hall visit. We'll give an update on that when we know more. There's cross-training occurring between city divisions to ensure that critical services remain consistent and operational during the duration. And again, those are water, sewer, garbage, and public safety. Our rapid transit volume is down, but now consistent. So we're reviewing best practices from other providers and through the Federal Transit Authority to determine what steps should be taken next in that regard. The State Department of Transportation has allowed work to resume on East Boulevard, reconstruction, so hopefully we'll be able to get that thing knocked out here this spring. And rumor control continues to be a challenge. So the rumor of the day, here's the answer. No, the airlines are not increasing air travel to Rapid City. Air travel is way, way down, perhaps as high as 30% of normal, but it's way, way down. So what we're doing today and throughout the week is we're creating strategic teams to address or coordinate information on things such as grocery and supply stores, their supply chain and consumer activity, also food distribution from nonprofit or other food sources, emergency planning relative to medical providers. We should be very proud of our medical providers. They are out there planning for the worst case scenario. And so as a city, we just want to be in touch with them to know what part we can play. We're also putting together a financial team to include the ongoing city budget status as well as any federal funding that may be available throughout this pandemic. And we're also putting together a communication team to make sure we're consolidating and disseminating information to and from the city, county, state, health officials, and public. So working together always seems to be a challenge for people in South Dakota, and especially western South Dakota. So we're really trying hard now, and we're going to implement a formal crisis management team to be able to address all of these issues seamlessly. There was a lot of angst last night at the City Council meeting over the first reading, the passing of the first reading of this ordinance. A lot of business owners there. It's heartbreaking to hear their stories of them not being able to make debt payments or pay employees. So undoubtedly, this next couple weeks is going to be a big week for layoffs. That is a reality. I'm glad to say that the governor's office has at least doubled the staff and capacity for those wanting to file unemployment claims. And for most of the people needing to file claims, it'll be the first time they've ever done it. So it'll be a little cumbersome perhaps at first. A little extra time may be needed. But we encourage everyone to look at their funding and financial options throughout this. The governor also predicted about another, based on current information, I should say. Everyone has a prediction, but the governor's this morning was about another 8 weeks or so until we peak at the amount of infections in our state. So our job, your job, everyone's job, is to try to stretch that the number of infections out as long as possible on the calendar, rather than peaking here next week or the week after, just so that we don't overwhelm the hospital capacity in our area. So everyone, look, there's a lot of information available to you that will cause you panic and discomfort, and I'm again just going to encourage you, probably every day encourage you, to stick to what's positive and understand that we're not in control of this virus. If we're going to get it, we're going to get it. We do have control over, through our behavior, how long of a period we can stretch that out over. If we all get sick at once, we cause chaos. If we get this virus over the course of a few months, then we're going to do well for our ability to deal with it as a community. So stay calm. Don't buy too many supplies. Leave some for your neighbor. That is going to become increasingly important as the days and weeks go on. So thanks for checking in today. Stay in touch, and I'll talk to you again tomorrow.